So first I'd like to introduce Lucy Luna. Lucy is a graduate from University Jose Simeon Canas in sociology and the University of El Salvador in public health. Lucy began her career in women's empowerment and community development in 1999 with the gender program World Conservation Union, surveying women leaders in local NGOs. In 2000, Lucy joined ASAPROSARD, the Salvadoran Association for Rural Health, as the coordinator for the International Assistance Program, which empowered the poor through healthcare, youth leadership training, education, microcredit, and development. In 2005, Lucy became the unit manager for the program's children and youth programs, where she created a new program, the Barefoot Angels, which specifically works providing education opportunities for children 7 to 18 years old. And over the years now, I've had a chance to work with Lucy for almost 14 years, and she's not only become one of my dearest colleagues, but also a dear friend of mine. So let's welcome Lucy.
As Karen says, my name is Lucy Luna. I'm from El Salvador, and today I'm wearing my yellow t-shirt, that is a ASAPROSARD t-shirt. And for me, this is a symbol of the work we do and the hope we bring to the communities. Because during the war, the organization was founded in the 70s. So we have, during that time, a civil war. So during that time, it was really difficult to attend people in the rural areas because, and also train health promoters because in the air, military thought that they were guerrillas with the backpacks and into the mountains. So the founder of the organizations went and talked to the guerrillas and also talked to the government and says, please don't kill our health promoters. And they said, we don't see you in the green, so we decided to have the yellow so people can see us in the green. So for me, this is a symbol of my organization and my hope. So I'm going to start telling you a little bit about my country so you can have a better idea where I came from. El Salvador is surrounded by volcanoes. In my town, there's more than 13 around. And also you can see pictures of how, the colonia came in the 18th century. So we have surrounded also by colonial architecture. This is Mayan. Also, my country came from Mayans. And we call pipiles, is the mix between Mayas and Choltecas. And also you can see the city and how the city is growing. My own story. My mother is a doctor. She is a human rights advocate. So I grew up seeing, her work. So during my childhood, I was really touched by the war and the violence I saw during that time. So I grew up seeing that the most vulnerable people of the violence was children. And also during the 90s, a new phenomenon started in my country that is maras, also known as a gangs, that is affecting also the life of many children and youth. So that's why I wanted to dedicate my life to advocate for children's rights. I want to start talking about the traditions in my country. The traditions in my country, we are a country of corn and beans. Also we have a lot of fruits and vegetables, and we have pupusas, is our traditional meal. And of course, breastfeeding is a tradition also, but that is changing. That is changing a lot. Globalization and modern life is changing all the traditions. So you can see now, those are the supermarkets full of junk food, and also drinks full of sugar are getting in the bigger and bigger sizes. We have a 3-liter Coca-Cola bottle that family, drinks almost every day. So kids are, instead of milk, beans, or eggs, they prefer Coca-Cola. Because they think, because they don't have food, sugar will give them calories. So children will be with more energy. And you see the other girl there with a plastic bag with Coca-Cola, because in some areas, children cannot afford a bottle, so they can put the Coca-Cola in a plastic bag so they can carry it home. So these are some of the big signs you can see in the city about, new ways of eating, like burgers and drinks full of sugar. So ASAPROSARD has different programs, like Karen was telling. And one of the programs I work with is a Sprout of Hope program. These programs work with early stimulation and preschool education. And this model attends in these different issues: community organization, community advocacy for children's rights, because there's a very high rate of sexual abuse, so we prevent that. Community leaders trained as children promoters, we have around 40, and family trainings in different issues, prenatal care, and child growth and development. Those are the things that the program works with. So I will tell you how the program started more than 10 years ago. So this is Karen Sokal. When she arrived and volunteered in our organization, she came with this mission, this vision of helping poor children. And she started noticing that the smiles of the children we were supporting were full of cavities. And people didn't have any information. And she started talking to the families, and she found out that the children's mouth had a lot of pain, and the relationship with malnutrition was just, making them being more malnourished. So this is how the research started. We start interviewing families and children, and this is the prevalence of caries by age. So you can see the age, and when they grow up, they have more prevalence of having caries. So when they are 6 years old, 90% of them has caries. And the decay also is really important to notice that in the age of 6, they have more than 8 or 7 decays in their mouths. So that is really affecting the life, and it's really hard to think how they can live with so much pain and also be good at a school. So what is the intervention we make with Dr. Karen and the volunteers? We'll start working in training children promoters and family and children about good nutrition. There's a very high rate in the community about using baby bottle. They put in the baby bottle Coca-Cola, coffee and sugar, or water and sugar. So that makes the tooth worse. And also about training oral hygiene, just simple as brushing their teeth. Giving toothbrushes and toothpaste, fluoride varnish 3 times a year, and referrals for their dental treatment. Because in my country, health promoters cannot apply varnish. We have to, go and work and coordinate with the Ministry of Health so they can apply the varnish. And also we start creating, and Dr. Karen and their staff create beautiful material for teaching the families and the kids about how to take care of their oral hygiene. We also create a character to help reduce the baby bottle habit, because it was really high, so we didn't know what to do. So the community says, why don't we create a baby bottle fairy? Because, parents, for them, it's really hard to take the baby bottle away. So if we create this character that goes into the community, and the mothers can say, the fairy took the baby bottle, so I cannot do anything. So we have a baby fairy, it's right here. So he comes every time we do a brigade, and she, instead of taking the baby bottle, she gave a cup sip, is how you go here. Mm-hmm. So the evaluation by annual mothers interviews, we do approximately 700, and children examination around 900. So these are some of the preliminary follow-up results. How you can see, some of the rates are little, what you see the changes between the 2000 and 2010. But one of the things that really changed is the daily junk food consumption, because people eat a lot of junk food in the rural areas. So how you see in the 2006, we found 34%. In 2010, because of the program, it decreased to 26%. So in the oral health practices also, you can see child has a own toothbrush, of course, is a little, you can see the difference. But in the mothers always of regular help children brush their teeth, because this never happened before, from 57%, we increased to 63%. And then what we feel proud of is how we help children getting better nutrition. You can see, when the program started, the malnutrition was 20%. And then when we finished the program, we saw how decrease that until 5%. And the obesity also started decreasing. So these are some pictures of the kids that are part of the program. And you can see how healthy their teeth are. And there's a promoter there from La Magdalena, because promoters, they compete to each other in a very good way, showing that they have more children healthy than the other. So there is a promoter that is showing how proud she feels of her little boy there that is healthy. And there's Dr. Karen visiting the program a few years ago. So these are some of the results we have had. Since 2011, we have a total of 2,122 boys and girls. 975 families group receive early stimulation and nutritional counseling, and now oral health education. And we also established an alliance with the Ministry of Health to coordinate the health brigades, because they were not involved before. So now they are part of the brigades with the community leaders. So we have now 39 children's promoters working in training in oral health. We have collected 275 baby bottles last year. So, and children's promoters refer 170 cases a year to the dentist. And the problems that they refer are caries, fillings, dental cleanings, and sealants. And family receives also toothbrushes and toothpaste 3 times a year. What are the lessons learned we had in our work? First of all, is the collaboration with the Ministry of Health, also education, because for us it's really important that children also practice their brushing teeth in the school, municipalities, local leaders, and Colgate. That, for us it's really important that civil society, the private sector, and also the government sit together and discuss the strategies to improve the situation. Teach families also to eat nutritional food, including traditional food. We have a book collecting recipes of, traditional food, so people can also practice that. Continue with fluoride, toothbrushes, and toothpaste application 3 times a year. We give the families. Children need to continue practicing toothbrushes at home and also at school. I already said that. And always use creativity to solve problems, like the baby bottle fairy. Because sometimes we're expecting that in books we're going to find solutions to our problems, and we don't hear people's solutions, and we don't use creativity. So I think that is really important. And for the future, for us with this experience, we have so much hope. Develop relationship with the private sector, as I said, is a lot of hope there. We need to make them involved in making the solutions. Coordinate with the Ministry of Health to implement oral health as a component of a maternal and child health services. Dr. Karen 2 years ago came to El Salvador and presented this research to the Ministry of Health. And they said, okay, we're going to look through. And now, they present this not with the minister, but with the assistant. And now the assistant is the Minister of Health. So in her speech a week ago, she said, I'm going to commit with oral health in the community. So we have there, a possibility to see if we can change the situation. Advocate through a Ministry of Education to eliminate junk food vendors in the school, because there's just junk food inside of the school, and that's the only thing the children can have. And create more educational materials about oral health to prevent children's diseases. And this is how I want to close with a success story. This is Mario. He's 4 years old. And Maria Julia is her mother. He's a housewife and helps her husband in the farm. They are poor, and her husband earns $4 per day cutting sugar cane. Her son Mario started the health promotion since she was born. She has shown a lot of interest in learning to give her son the best start. She received from the health worker oral health education, toothbrushes, and toothpaste. And her son received fluoride varnish 3 times a year since his baby teeth came in. So he has no caries. Mario is 4 years old, has no caries, perfect nutritional status, and he is doing excellent in preschool. His smile demonstrates us his happiness, but also his health and hope for a better future. And this is a quote that her mother said to us. We don't have property or money to leave to our children when we die. The only thing we can give to them is their health. He can grow up now with so many more possibilities. Thank you for giving us this opportunity. So, gracias. Thank you for inviting me to be part of this. And especially we want to thank Dr. Karen Socal Gutierrez, who is a pioneer in the team, and he had been a great supporter to the program in El Salvador. Also to the Berkeley University students, they have come through the last 10 years, and volunteers that had helped from here, from San Francisco, to work hard creating the data for us. And also Dr. Abiki Guzman, who is the doctor who found organizations and the children and the staff promoters in El Salvador. So thank you. I'm going to be here if you need any response or question you have.